Hello, everyone. Today we are diving into a vital skill for every nurse. It is critical thinking. Nursing is so much more than just following orders. It's about understanding your patients deeply. It involves making smart, quick decisions. Often, these decisions can be life-saving. Critical thinking is truly your superpower in the healthcare world. It helps you provide the best possible care. It ensures patient safety. So, what exactly is critical thinking in nursing practice? Imagine you are a health detective. You gather clues from your patient. You look at their symptoms and their history. You analyze all the information very carefully. You evaluate the evidence before you. Then, you consider different paths you can take. Finally, you choose the very best action for your patient's well-being. This thoughtful process is critical thinking in action. The NCLEX exam is designed to test this crucial skill. It is not just a test of memorized facts. The NCLEX presents you with patient scenarios. These are like mini stories from a real hospital. You must apply your nursing knowledge to these situations. Practicing with real-life patient scenarios is the best way to get ready. It connects what you learn in books to what you will do for actual patients. This connection is key to success. In this guide, we will explore some realistic patient scenarios together. We will break each one down step by step. We will look closely at patient demographics and their stories. We will use the SBAR communication tool. This tool is essential for clear reporting. This journey will sharpen your critical thinking skills. It will build your confidence for the NCLEX. More importantly, it will prepare you for a rewarding nursing career. Let's begin with our first patient. His name is Mr. David Chen. Mr. Chen is a 68-year-old gentleman. He has a significant smoking history. He smoked for about 40 years. He also lives with hypertension, which is high blood pressure. Today, Mr. Chen has come to the emergency department. He is struggling to breathe. This shortness of breath has been getting worse over the last 3 days. He is clearly uncomfortable and needs help. Now let's think about Mr. Chen's demographics. His age, 68, tells us he is an older adult. Older adults can have different health challenges. His long history of smoking is a major red flag for lung problems. His hypertension adds another layer to his health profile. These details are not just small facts. They are vital pieces of the puzzle. They help us start thinking about what might be wrong. They guide our first steps in assessing him. When we first see Mr. Chen, he looks anxious. He is using his extra chest and neck muscles to breathe. This is a sign of respiratory distress. He can only speak in short sentences. This also shows how hard it is for him to breathe. His wife is by his side. She appears very worried about him. She tells us he has had a cough for about a week. This cough produces yellowish mucus. All this information is very important for us. Understanding diverse patient backgrounds is absolutely essential in nursing. Factors like age, lifestyle choices, and existing medical conditions all play a big role. They can change how a disease shows up in a person. They also influence the best treatment plan for that individual. We must always look at the whole patient. We cannot just focus on the symptoms they present with. Every detail matters for good care. Now let's use the SBAR format to talk about Mr. Chen. SBAR helps us communicate clearly and effectively. Situation: Mr. David Chen is a 68-year-old male. He has presented to the emergency department with acute respiratory distress. His main symptom, shortness of breath, has significantly worsened over the past 3 days. He is currently in the ER and needs our immediate attention. His condition appears serious. Background: Mr. Chen has a 40-year history of smoking. He has a known diagnosis of hypertension. For the past week, he has had a productive cough. The sputum or mucus from his cough is yellowish. He has no known allergies to any medications. His regular home medication includes lisinopril, which he takes for his high blood pressure. This background helps us understand potential underlying issues. Assessment. Our initial assessment of Mr. Chen shows he is alert but very anxious. His respiratory rate is high at 30 breaths per minute. His oxygen saturation is low, only 88% while breathing room air. When we listen to his lungs, we hear wheezes and crackles in both lower lung areas. His heart rate is fast, at 110 beats per minute. His blood pressure is elevated at 150 over 90 millimeters of mercury. These signs point to a serious breathing problem. Recommendation. Based on this assessment, I recommend several immediate actions for Mr. Chen. First, we need to start him on supplemental oxygen. This will help improve his oxygen saturation. We should request an order for a chest X-ray. Arterial blood gases, ABGs, are also crucial to assess his respiratory status. We should collect blood cultures and a sputum sample to check for infection. An intravenous IV line should be started for medications and fluids. The doctor has ordered several important tests for Mr. Chen. Let's look at his initial lab results. His white blood cell, WBC count, is 15,000 per cubic millimeter. This is higher than normal. An elevated WBC count usually suggests an infection is present in the body. His C-reactive protein, CRP level, is also high. CRP is a marker of inflammation. These two results are strong indicators. They tell us his body is fighting something significant. Mr. Chen's arterial blood gas ABG results are back. They show pH 7.30. His PaCO2, or carbon dioxide, is 55 millimeters of mercury. His PaO2, or oxygen, is 60 millimeters of mercury. His HCO3, or bicarbonate, is 26 milliequivalents per liter. What do these numbers mean for Mr. Chen? Think about whether his body is in an acidic or alkaline state. Is the problem respiratory or metabolic? Is his body trying to compensate for the imbalance? How do these ABG values connect to his difficulty breathing? The chest X-ray provides more clues. It reveals hyperinflation of his lungs. This means his lungs are overfilled with air. The X-ray also shows flattened diaphragms. Flattened diaphragms are often seen in certain lung diseases. Additionally, there are infiltrates or cloudy areas in the lower lobes of his lungs. These findings are consistent with a serious lung condition. What specific conditions might Mr. Chen have, given his history and these results? How do all these pieces fit together? Now, critical thinking questions come into play. What is the most likely main diagnosis for Mr. Chen? We should consider a COPD exacerbation. This is a flare-up of chronic obstructive pulmonary disease. Pneumonia is another strong possibility. Or could he be suffering from both conditions at the same time? How has his long history of smoking contributed to his current illness? What is the underlying pathophysiology that is causing his wheezing and the crackles we hear in his lungs? Section 5. Caring for Mr. Chen. Key nursing strategies. Our top priority for Mr. Chen is to help him breathe easier. We must administer oxygen as the doctor prescribed. The goal is to keep his oxygen saturation above 90%. We should help him into a high Fowler's position. This means sitting him up in bed, or he can use an orthopedic position, leaning over a table. These positions help his lungs expand more fully. We need to monitor his respiratory status constantly. Watch for any signs of improvement or worsening. Medications will play a very important role in Mr. Chen's treatment. We can expect the doctor to order bronchodilators. A common one is albuterol. This medicine helps open up his airways. Corticosteroids will likely be prescribed. These medications reduce inflammation in his lungs. If a bacterial infection is suspected, antibiotics will be given. It's our job to educate Mr. Chen and his wife about these medications. Explain why he needs them, and any potential side effects. We also need to monitor Mr. Chen's fluid balance and his nutrition. Being in respiratory distress uses a lot of energy. His body's metabolic demand is increased. He may need IV fluids at first, especially if he is too breathless to drink. Once he is more stable, encourage him to drink plenty of fluids orally. A diet that is rich in calories and protein will support his recovery process. Small, frequent meals are often easier for him to tolerate than large ones. Patient education is absolutely vital for Mr. Chen's long-term health. We must discuss smoking cessation. Quitting smoking is the best thing he can do for his lungs. We can provide him with resources to help him quit, teach him breathing exercises. Pursed lip breathing can help him manage shortness of breath. Explain the importance of getting flu and pneumonia vaccinations. Help him understand the warning signs of worsening symptoms. This empowers him to manage his condition better. Section 6. Introducing Miss Anya Sharma, a young adult with abdominal pain. Let's move to our second patient scenario. Meet Miss Anya Sharma. Miss Sharma is a 22-year-old female. She is currently a university student. She has come to the urgent care clinic today. Her main complaint is severe pain in her abdomen. She tells us the pain started quite suddenly. It began about 12 hours ago. The pain is located in the lower right side of her abdomen. Think about Miss Sharma's demographic information. She is young, only 22 years old. She is female. These two facts are very important when assessing abdominal pain. There are certain conditions that are more common in young women. Her lifestyle as a university student might involve stress. It could also mean she has irregular eating habits. We need to gently explore these aspects. What common health issues could cause this type of pain in a young woman? Ms. Sharma describes her pain as sharp and constant. On a pain scale from 0 to 10, she rates it as an 8. This is quite severe pain. She also reports feeling nauseous. She has vomited once since the pain started. She has a low-grade fever. Her temperature is 38.0 degrees Celsius, which is 100.4 degrees Fahrenheit. She tells us she has no significant past medical history. Her last menstrual period was 2 weeks ago, and it was normal. This initial information helps guide our thinking process. The location of the pain in the right lower quadrant is a key clue. The nature of the pain, sharp and constant, is also important. The associated symptoms like nausea, vomiting, and fever add more pieces to the puzzle. Her menstrual history is relevant to rule out certain gynecological issues. We must be very systematic in our approach. We need to consider various possibilities and then narrow them down. Section 7 S-Bar and Assessment for Ms. Sharma. Let's use the S-Bar format for Ms. Sharma as well. Situation: Ms. Anya Sharma is a 22-year-old female. She presents to the urgent care clinic with acute, severe abdominal pain. The pain is localized to her right lower quadrant. It began approximately 12 hours ago. She is also experiencing nausea, has vomited once, and has a low-grade fever. She is visibly uncomfortable and requires prompt assessment. Background: Ms. Sharma is a full-time university student. She reports no significant past medical history. She does not take any regular medications. Her last menstrual period was 2 weeks ago and was normal. She has no known allergies to medications. She appears quite distressed due to the intensity of her pain. This background helps us focus our diagnostic thoughts. Assessment. Upon physical examination, Ms. Sharma is alert but clearly in pain. Her temperature is 38.0 degrees Celsius, which is 100.4 degrees Fahrenheit. Her heart rate is slightly elevated at 98 beats per minute. Her respiratory rate is 20 breaths per minute, which is normal. Her blood pressure is stable at 110/70 millimeters of mercury. When we examine her abdomen, it is very tender in the right lower quadrant. She exhibits rebound tenderness and guarding in that area. Her bowel sounds are hypoactive, meaning less active than usual. Recommendation. Based on these findings, I recommend immediate further investigation for Ms. Sharma. We must urgently rule out acute appendicitis. A surgical consultation may be necessary very soon. We need to obtain blood tests. This includes a complete blood count and a C-reactive protein level. A urine pregnancy test is essential for any woman of childbearing age with abdominal pain. An abdominal ultrasound or a CT scan should be strongly considered to visualize the appendix. We also need to provide her with effective pain relief. Section 8. Ms. Sharma's Diagnostic Journey and Critical Insights. The lab results for Ms. Sharma are now available. Her white blood cell count is 18,000 per cubic millimeter. This is significantly elevated. The report also shows a left shift in the white blood cells. This pattern typically indicates an acute bacterial infection. Her C-reactive protein level is also high, confirming inflammation. The urine pregnancy test came back negative. These lab results strongly support our suspicion of a particular abdominal emergency. What condition fits this picture? An abdominal ultrasound was performed quickly. The ultrasound images show a non-compressible, dilated appendix. The wall of the appendix appears thickened. The sonographer also noted a small amount of free fluid near the appendix. These are classic ultrasound findings. They are highly suggestive of acute appendicitis. This diagnosis clearly explains her severe pain, fever, nausea, and vomiting. It all fits together now. Let's consider some critical thinking questions related to Ms. Sharma's case. What is the underlying pathophysiology of acute appendicitis? Why does the pain in appendicitis often start around the umbilicus, or belly button, and then move to the right lower quadrant? What are some potential and serious complications if acute appendicitis is not diagnosed and treated promptly? How did Ms. Sharma's age and gender influence the initial list of possible diagnoses we considered? Key patient care strategies for Ms. Sharma will now focus on preparing her for surgery. The likely treatment for acute appendicitis is an appendectomy, which is the surgical removal of the appendix. She must be kept NPO, meaning nothing by mouth. This is standard before surgery. Administer IV fluids as ordered by the doctor to keep her hydrated. Provide appropriate pain medication to make her more comfortable. Monitor her vital signs very closely for any changes. Prepare her psychologically for the likely surgery. offer emotional support, and explain all procedures clearly. Section 9. Mastering NCLEX and Beyond, the Scenario Advantage. We have carefully walked through 2 different patient scenarios today. We met Mr. Chen, who was struggling with severe respiratory distress. Then we met Ms. Sharma, who presented with acute abdominal pain. These examples clearly show how critical thinking is applied in nursing. It's not just about remembering facts from a textbook. It's about using that knowledge to care for real people in real situations. This is exactly what the NCLEX exam evaluates. Using tools like the SBR format helps you organize complex patient information. It ensures that you can communicate vital details clearly and concisely to other healthcare team members. Reviewing lab results and diagnostic tests provides crucial clues. These tests help confirm or rule out potential diagnoses. Understanding the pathophysiology, or the why behind diseases, helps you connect all the dots. You begin to see why certain symptoms occur. You understand the reasons for specific nursing interventions. This deepens your learning significantly. Patient care strategies are then carefully tailored to each individual patient. You consider their unique circumstances, their history, and their current needs. You learn to prioritize your nursing actions based on urgency. You educate patients and their families, empowering them to participate in their care. This holistic and patient-centered approach is the true heart of excellent nursing practice. This skill goes far beyond just passing an exam. It will shape your entire career as a compassionate and effective nurse. So my best advice is to keep practicing with real-life patient scenarios. Dive deep into each case study. Analyze every piece of information presented. Constantly ask yourself why questions. Challenge your own assumptions and think through alternatives. This type of active learning builds strong clinical judgment. It will make you a confident, competent, and caring nurse. You will be thoroughly prepared for the NCLEX, and even more importantly, you will be truly ready to care for your patients.